Hey everyone, have you ever faced a COB denial and felt stuck? Coordination of benefits is a tricky concept, but understanding it is the key to avoid denials. In today's video, we're gonna see what is coordination of benefits, why these denials happens, and how to fix them once we receive the denial, and finally, how to prevent them in the future. If you're new to this channel, please click the subscribe button below this video so you get notification every time whenever I post new content, helping you to stay updated and improve your skills in this field. Join our community and let's grow together. What is COB? COB stands for Coordination of Benefits. When a patient has more than one insurance, the patient has to update the insurance which one should be primary and which one should be secondary. For example, if the patient is having their own health insurance policy, also he is covered under their spouse health insurance policy. Now the patient has to call the insurance and inform them which one should be the primary and which one should be the secondary. Why do COB denial happens? COB denial often occurs because of these three reasons. Missing or incorrect COB information. If the patient's primary and secondary insurance details are not updated. Failure to submit the claim to the primary payer first. Claims incorrectly sent to secondary insurance before submitting it to the primary insurance. Expired COB records. If insurance records are outdated and don't reflect the patient's current coverage. If you're receiving a lot of denials and you want to streamline your billing process, you can contact me. I'm a certified professional coder and biller. I can help you to grow your business. How to resolve COB denials? Once you get the EOB or ERA, confirm the COB denial. Call your patient and tell them the claim was denied for coordination of benefits, and tell the patient to call the insurance and update the coordination of benefits. Contact the patient after a couple of days and ask them whether they have updated the COB with their insurance or not. If they have updated the coordination of benefits with their insurance, then call the insurance company and try to reprocess the claim. Document the call reference number in your billing software for future reference. Check the claim status with their payer portal after 10 days. If the claim is still not paid, then call the insurance and check the reprocess status. How to prevent COB denials? Prevention is always better than cure. During patient registration, document all the insurance details, including primary and secondary insurance details. Regularly check patient's eligibility and COB status before services are rendered. Inform all your patients about the importance of COB updation with both the insurance company and the provider's office. I hope you liked this video. Follow me for more medical billing and coding related videos. If you want any denial topics to be covered, please mention in the comment section.